everyone, welcome to my channel Heal Via Homeopathy. Today we will be discussing a very common condition among women, that is PCOD, also known as polycystic ovarian disease. We will cover its definition, causes, signs and symptoms, lab investigations, homeopathic treatment, and general management. So let's get started. First, we'll talk about what PCOD is. So PCOD is known as polycystic ovarian disease, is a hormonal disorder that affects women of reproductive age. And in this condition, the ovaries produce an abnormal amount of androgens, that is male hormones, that are usually present in small amounts in women. This leads to irregular menstrual cycles, cyst formation in the ovary, and difficulty in conceiving. Now we'll talk about the main causes of PCOD. So first is hormonal imbalance, which is a core problem in which there is increased androgens, which interferes with the normal ovulation and which leads to irregular or absent periods. Multiple small cysts are formed in ovaries and which leads to acne and excess facial and body hair. Second, we have insulin resistance, in which the body cells don't respond properly to the insulin, causes high insulin levels, which stimulates ovaries to produce more androgens, which worsen hormonal imbalance, strongly linked with weight gain and risk of diabetes. Third, we have genetic predisposition. PCOD often runs in the family. If mother and sister has PCOD, risk is higher. Certain genes affect insulin metabolism and hormonal regulation. Fourth, we have lifestyle factors in which there is sedentary lifestyle, unhealthy diet, lack of physical activity, poor sleep, and chronic stress. Next, we have obesity and overweight. Excess fat tissue increases insulin resistance and androgen production, creates a vicious cycle. PCOD leads to weight gain, and weight gain leads to worse PCOD. Sixth, we have chronic low-grade inflammation. Many PCOD patients have low-grade inflammation. Inflammation stimulates ovaries to produce more androgens, contribute to metabolic disturbances. Seventh, we have environmental and endocrine disruptors. Exposure to chemical may interfere with hormonal balance. PCOD is caused by hormonal imbalance and insulin resistance, influenced by genetics, worsened by lifestyle factors like poor diet, stress, lack of exercise, and weight gain. Now we'll talk about the signs and symptoms of PCOD. PCOD can show a variety of symptoms which may vary from person to person, in which we have pelvic pain, irregular periods or absent menstrual periods, excess hair growth on face, chest and back, acne and oily skin, weight gain is there, especially around the abdomen, thinning hair or hair loss on the scalp, fertility issues or difficulty in conceiving is there, darkened skin patches around the neck or underarms, acanthosis nigricans, which is known as acanthosis nigricans. Now we'll talk about the lab investigations for PCOD. First is hormonal profile, helps in detection of androgen excess and ovulatory dysfunction. So in this, LH and FSH ratio is 2:1. Testosterone is high. DHEAS may be high. DHEAS is dehydroepiandrosterone sulfate. It is a steroid hormone primarily produced by the adrenal glands, essential for creating testosterone and estrogen. So it is high. Third, we have prolactin to rule out hyperprolactinemia. Then we have TSH to rule out thyroid disorders. Hypothyroidism can mimic PCOD. Second, we have metabolic and insulin resistance test. PCOD is closely linked with metabolic syndrome. So we'll do fasting blood glucose, fasting insulin, insulin resistance index. For that, we have HOMA IR, and we have oral glucose tolerance test, especially in overweight patient. We'll do HbA1c also for long-term glucose control. Third, we have lipid profile to assess cardiovascular risk. Total cholesterol is LDL often high, HDL is less, triglyceride may be high. Then we have ovarian ovulatory markers, optional but supportive. AMH, that is anti-Mullerian hormone, often increased in PCOD. Progesterone mid-luteal phase में low suggest an ovulation. Test to exclude other causes, that is differential diagnosis. 17 hydroprogesterone to rule out congenital adrenal hyperplasia. Cortisol if Cushing syndrome suspected. Pregnancy test in amenorrhea. So lab investigations in PCOD help assess hormonal imbalance, insulin resistant, metabolic risk, exclude other endocrine causes. Now we'll talk about the top 5 homeopathic medicines for PCOD. First is pulsatilla. Key symptom is delayed and irregular menses in mild emotional and VP girls. Second is sepia. Key symptom is irregular periods with hormonal imbalance and bearing down sensation. Third is natramune. Key symptom is long-standing menstrual irregularity and suppressed emotions. Fourth is calcarea carb, in which PCOD is in overweight patients with slow metabolism. Fifth is lechesis, in which irregular menses with left-sided ovarian complaints, worse before periods. So in PCOD, there is an individualized treatment based on the totality of symptoms. I will talk about the general management of PCOD. Along with homeopathic medicines, lifestyle changes can play a key role in managing PCOD. Maintain a healthy diet, exercise regularly, maintain a healthy weight, manage stress by doing meditation and deep breathing, regular monitor blood sugar and hormone levels. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to Heal Viora Homeopathy for more health tips and natural remedies. Stay healthy, stay happy, and remember your hormones are important, so take care of them. Remember, your healing begins with right consultation. For consultation and guidance on the supervision, reach out to Heal Viora Homeopathy Clinic. DM for appointment.